Viet. I'm the Business Development Manager and Key Accounts. I'm the Key Accounts and Business Development Manager here at Interfuse. Today we have Mario Gupta, who's the Primary Health Consultant at Larter Consulting. Specializes in supporting organizational development and growth, project management, relationship management, and has held positions in both the healthcare and banking sector. Also with us today is Scott Lundstrom, who's a Senior Industrial Strategist, primarily in the healthcare, consumer goods, and retail sector, with a wealth of experience in the cybersecurity space. So thank you both for joining.
Thank you.
Is there anything that I've missed about your introductions? Is there anything that you'd like to add?
That's great.
Okay, great. Really just opening up, we were seeing a lot of threats and news in the industry about, cybersecurity being such a big talking point. We're seeing a lot of threats and hacks and breaches within the healthcare industry, not just in Australia, but also worldwide. I suppose a question for you, Scott, do you have any statistics around, or statistics that you can share around cybersecurity and breaches in the healthcare sector?
Well, it's interesting, and as you said, it's a very diverse market. There's lots of different ways that you can be put under threat. I think if we take a piece of the market that I have very good recent data on, so if we look at ransomware losses in the United States, the FBI just announced an estimated figure of $10.3 billion for last year in the US.
Wow.
And that's really a staggering sum. I mean, you think of the actual healthcare programs and the improvements in infrastructure we could fund with that loss, and then the actual human cost that those interruptions have on patients, on clinicians, on schedules, on families. It really is an area that's ripe for attention.
Yeah, definitely. And do you think that those threats differ when compared to others or other industries, or is that?
No, I don't. I honestly, the technologist in me is somewhat fascinated here, right? Because, historically the threat environment had been kind of this one-to-one space, right? An attacker would single out an institution and they might attempt to breach. They might attempt to gain some kind of economic value. Now we actually have attack as a service, right? We have cloud-based attack toolkits that you can lease out, just like you can lease out enterprise software. And so now instead of you against one attacker, it's you against hundreds of attackers. Healthcare organizations tend to come up to the top of the list. They're seen as rich in terms of data. There's an expectation that their infrastructure might be somewhat dated. And what happens now is these health systems now have to defend against thousands of attackers that are all running relatively sophisticated cloud-based attack tools.
Yeah.
So, honestly, they don't really have a choice. You have to figure out a way to create leverage, right? Right now, the attackers have this asymmetric relationship with the victims. And you have to really think about, do I need to deploy the same kind of tools? Do I need a managed service for security? Do I need a group of experts that live and breathe that stuff that maybe could defend all of us instead of just me trying to figure it out on my own? So, I do think the market is going through a real evolution here.
Yeah, definitely. Great. And Mario, from your perspective, I suppose, what are you finding are the common cybersecurity mistakes or trends in general practice that, that may impact those practices, those patients, and, the general public overall?
Yeah, well, as you would know, Viet, we work with general practices all around Australia, and it seems to be that our focus lies more with our regional and remote counterparts than it does with our metro counterparts. And it's not to say that our metro counterparts are immune to this, but we've got real data of where this is happening in regional and remote, where it seems to be more targeted in terms of that approach of cybersecurity, because they know that the infrastructure in a regional and remote town is going to be far less, and the ability for a practice manager or a practice principal to be able to reach out to someone within minutes, and getting that on tap support is very, very hard. And what ends up happening is that therein lies the biggest issue, because the problem doesn't go away, but the support mechanism that is for the general practice starts to rely inwardly. So it's very intrinsic in its purpose. And what happens is that the gatekeepers, who have forever been known as the reception staff, are the ones who deal with all the emails that are coming in, all the phone calls that are coming in. They're trying to decipher within few seconds, is this real? Is it not? Is it, does it need to go to a doctor? Does it need to go to a nurse? Does it need to go to the practice manager? So they're spontaneously trained to make all of these decisions that are happening very, very quickly. And then on top of that, you throw in the patient that's standing in front of them that needs to be seen in order to be checked in, so that the doctor can then take them into the consultation room. You've got a patient who's sitting in the waiting room, and all of these variables start to play in. And they've got, where it used to be that a cybersecurity threat could potentially happen, you know, as we always imagined it being in like the dark corridor room that happens down in the hospital somewhere. It's not. It's actually happening in real life scenarios on everyone's computers every single day. And it can be as simple as an email that has a link on it that accidentally gets clicked. And the reality of it is that in general practice, especially here for us in Australia, it's not individual computers. They're all connected because they have a driver, they have a database that's linked physically on premises, or it's cloud-based in a, you know, IT server room through the IT provider somewhere else. But the reality of it is that every single computer within that general practice is connected. And if one reception staff or a nurse or even the practice manager or the doctor who clicks on this one particular link that can potentially cause a gate to open, that's all they need. They just need that window to be open just that little bit so that they've got a peep in. And what happens is that, and I've seen this from experience, we've had general practices who've accidentally clicked on this particular link, realize that it's after they've clicked it, that it's the wrong thing that I should have clicked. So what they do is they quickly delete it. Then they go into their deleted folder and they delete it again so that it's deleted forever because it's not in sight anymore. So automatically they start to think, oh, it's gone, everything's okay. And what happens is that a day goes by, nothing happens. A week goes by, nothing happens. But that's the whole idea and the mechanism behind cybersecurity, and that ransomware or that phishing email or that data breach email that comes through. They don't target you the moment you open that window. They target you a month later, so you can't track it back to that particular email that was opened today, for example. And one of the biggest things that we're finding with our work in this space is that we're actually having to go back to the very basics of working with the whole team and actually saying, for you to get value out of the training that we're about to provide, it's not just for the doctor or the nurse, or it's not just for the practice manager, it's for the whole practice. So everyone needs to switch off for an hour and listen to us and learn from each other's experiences, because as our gatekeepers are the ones that deal with the most volume every single day, they need to be the ones who are front and center in that training to give those real life examples to the doctors, to the nurses, to the practice managers. And that's one of the biggest things that we've started to find, to the point where we've even spoken to some practices in rural and remote communities that they've said that they've reverted back to faxing because it's a more secure way of communicating with their clients or with the local hospital that's in the community or other health service providers, because it's that habit for people has not been able to potentially be drawn out of them, because during COVID, in the peak of COVID, general practices went through enormous amounts of change. And in that enormous amounts of change, they also had to become what I call digitally active. And that digital activation just happened by an overnight switch, because the government said, no more faxing. You need to go into a secure messaging protocol, whether that be using Argus, whether that be using medical objects, whether that be using something else that allows you to be able to do that. But there was no training or support provided for general practice. So then what's happened is that if they've made mistakes, or they've found the system to be clunky, or it's just time consuming, they've reverted back to the old behaviors. Why? Because it was easy. It was a learned behavior. It just was what worked. And because of that lack of education for what is now the new protocol, and what is now the new expectation for all health services in Australia, unfortunately, we're seeing lots of gaps and holes in that. And that's where education is going to be one of the key things that brings everyone to the 21st century.
Yeah.
Yeah.
I do think it's important to remember how, honestly, heroic some of the rural health providers are. Yeah. Right. This is not that they don't want to do it.
That's right.
It's they lack the skills and the resources. And honestly, the regulators should be a little more sensitive to this. But again, exactly. Providing them a service so they can utilize the technology without having to own it is a big part of the solution here, I think.
Yeah. The other thing that we found as well has been cost. Again, for rural and remote areas, you've got cost associated with taking on new programs like this to be able to do. You've got to take out licenses. And one of the biggest complaints or pain points for general practice is that you've got so many different programs. You've got HealthLink, you've got Health Direct, you've got Medical Objects, you've got Argus, you've got, and you can name a list of 10 very, very quickly. And one practice will use Argus, for example, but the other clinic will use Medical Objects. One clinic will use HealthLink, the other one will use something else. And because there is that lack of interoperability between the organizations in that space, they don't know which ones to take out for their practice specifically. And then if you're having to take out 2, maybe 3 different programs just so that you can actually communicate between one organization and the other, it becomes an expensive exercise for a general practice, especially where we've seen so many changes that have happened in general practice over the last 2.5 years, where bulk billing practices are no longer even viable to operate. Why? Because of these costs. And so the cost is then unfortunately being outlaid out to the patient. And for a lot of communities, that's very, very hard.
Yeah, definitely. And I definitely agree on that interoperability piece. We've seen, all those secure messaging tools that are out there, and, there's not one product that fits all, just with, with everyone's location, what their services that they're providing, and also, just other resourcing pieces as well. So we definitely see some improvements around where that secure messaging can go going forward. So Scott, from your perspective, I'd love to hear from you around, the kinds of softwares and cybersecurity solutions that, you've seen in general practice that would align with, what's happening in general practice at the moment, and how they can evolve with something like, the opentext, with the support or the resources or solutions provided by opentext.
Sure. I think, the most important thing is kind of to get started and to accept that this is challenging. I do think, and Mario made a great case. The threat environment has really changed a lot over the last couple of years. All right. And the thought that a small group of individuals with limited resources can take this challenge on, I think it's optimistic. We look at a significant breach every other day in the US. The pace and the variety and the volume of attacks really dictate that you have to think more about, how do I put my communications in a bubble? All right. And that means you really have to think about a multi-pronged approach. First and foremost, you have to be able to detect and prevent threats. Right. You have to, and that typically now requires a real research capability, an ability to react to zero-day, an ability to react to big disclosures. You have to be able to understand the context of those threats and be able to rapidly respond to incidents. And I think that, again, I mean, requires an ability to detect and respond and communicate very quickly. So this is a place, again, I think, you know, we see kind of web-based and cloud-based environments that are able to react very quickly. All right, I have health systems that run software on-prem. It may take them 6 months to patch a flaw in critical infrastructure. So, you know, that integrated threat response really allows you to understand the threats, prioritize them, react to them quickly. There's a whole nother component about understanding the threat environment and really beginning to analyze your own traffic and to look inward. All right. You know, recently we've seen individual doctors picked off for never having adopted HIPAA in the US, right? They just ignored it. Well, now we can finally go figure that out. So, you know, we have to be able to expose those hidden threats. And the hidden threat surface is growing really dramatically. All right. When we think about the movement to support telemedicine, you know, when we look at hospital at home services, when we look at, you know, chronic disease management, you know, so many chronic diseases can honestly be managed by a PCP with a device in the home, right? We don't need that whole specialist loop. We don't need all those lab tests. I mean, we really can, once we get someone with a chronic disease to a point where they're well managed, we can keep them on the path very inexpensively with some in-home technology. But we have to be able to protect those endpoints, and we have to be able to remediate infected endpoints. And that's a big threat, right? So, you know, once we're on kind of a bring your own device environment with the patient, it's a whole new world. So we have to think about things like zero trust. So we really try to deliver an integrated end-to-end capability. I don't really want to get into products and features and functions.
Okay.
All right. I like to talk about that integrated. We detect, we response, and we help you operate an infrastructure with good hygiene, right? And in my mind, those are the three big capabilities we bring to healthcare. We are one of the largest cloud service providers in the world. We work with many large federal governments, many large health systems. So we have a lot of experience doing this. But to me, that's really our capability in the marketplace.
Yep, that makes a lot of sense. And Mario, from your perspective, you know, does that sound like something that would be an improvement from what they're currently using as a cybersecurity solution in the practice? And you know, how do you think that along with the training that you provide, can really improve or minimize the breaches within the practice?
Yeah, there's a few general practices who I've spoken to of recent times in the last 6 months, for example, who, when I spoke to them about cybersecurity or just an awareness of digital tools that are available for them, it didn't surprise me. It surprised me the first couple of times, but it didn't surprise me after a few attempts when I had these conversations where doctors or practice owners or practice managers were telling me that Norton antivirus was their solution. Right. You know, and as part of the RACGP's 5th accreditation standards, you are required to now have a business case. And I always said to them, well, what's your business case entail? What do you have in your business plan that clearly demonstrates where you are today and where you want to be in 5 years' time, hypothetically? And they'll tell me about, you know, we're going to employ X amount of doctors and we're going to be able to see X amount of patients, and that's going to be able to increase revenue by X amount of dollars. And all in all, the practice principals are going to be really, really happy. Why? Because we've got a profitable business. And I said, okay, well, that's all really well and good, but where's your infrastructure? Not just physically, but also in that software space. Where is your infrastructure from a security space? And the more and more I talk to them about it, and I know that this is an old statistic, but in Australia, for example, you know, from 2021 to 2022, we saw an 84% increase in data breach attacks for general practice. So this is very simple, like Scott just mentioned, you know, hundreds of people using a cloud-based system to attack your system. and your system is one singular destination that they want to get to, but they're not just attacking yours, they're attacking every single general practice that is potentially available in the open market for them to be able to attack. And the reality of it comes down to the fact that those practices that have a well-established IT infrastructure, which is most likely going to be a third-party organization that is providing that support to them. It's not them directly employing a full-time IT manager. It's actually a network of people that are working for that practice. They are well protected and much more sophisticated to be able to even potentially block those emails from even entering into the reception inbox, for example. You know, and one of the pain points that again comes back from this space is that reception staff are receiving so much volume of data via email now because of these things like medical objects and Argus and so on, where we've even got general practices where patients are emailing them things directly. And the reality of it is that that email that's coming through to them is potentially with a PDF, you know, or it looks like a PDF document. And the reality of it is that, you know, click here and you'll be able to download this PDF, which is secure. You have to put this password in, and then that way you'll be able to access it so you can merge it into the patient's file. And these are all the things that staff are looking for, and they go, it's safe, so I'm going to click it. And when they click it, they realize that it's a corrupted file, and that's actually now going to start feeding into their clinical software. And that's where those behaviors come into play. And so one of the things that we've actually started to do with our general practice staff is that one of the key trainings that we've provided for a long time before this even became an issue was triage. So not just triage via a phone call when you're dealing with the patient on the phone, or not just triage when you've got a patient physically standing in front of you. Our training has now also evolved to look at triage for that patient who is sending you something, or that file that's coming through to you that you need to make some quick decisions on. And so potentially having the ability within the practice to work through a scenario where they can go, this is best practice. So we're going to look at the email. If you've got a doubt about the email, don't just make a decision unanimously. Get your peer to come and have a look at it with you. Have two people make a decision at that point in time. If you have made the mistake of putting through or clicking on something that could potentially be suspicious, fill out an incident form, because that incident form is going to be a physical record within your practice of learned behaviors. It could potentially change some policies and procedures within your practice. All of those things need to start to happen. And the reality of it again comes down to the fact that you're resource poor, not just from a time perspective, but also from a workforce perspective. We've got so many people who've unfortunately been burnt out and left general practice. And the new upcoming staff that are coming into this space of work don't have the relevant expertise or the experience. And so then you've got people that are being trained for a week at most, maybe 2 weeks max, and then they're being put into the deep end of, okay, now you've got to start doing your work autonomously. And so there's that real sense of pressure that comes into play on a day-to-day basis, which does also lead to things like burnout. And so if you're not actually looking out for your own self-care in that regard as a general practice staff member, you're going to lead to that place where you're going to be making some really poor decisions. And in those decisions, it can have some significant ramifications for the general practice as a whole. So there's just a few things that we've brought up, but from a training perspective, yeah, triage is probably the most important one in that space of digital health.
Yeah, perfect. Great. And Mario mentioned just then the ramifications. Scott, what kind of ramifications or potential liabilities would you say that you've seen for a general practice?
It genuinely can be staggering. I think just to finish off on what Mario said, I mean, it's important to realize how automated, how roboticized these attack vectors are, how, the attackers are literally using RPA on cloud systems to run SaaS-based attacks on you. And automation pays big dividends there, right? When you detect an attack signature once, you have it forever. You apply it to every email that runs through the hub. And, you know, you can really begin to cull down the volumes. You can focus them to a security specialist, you know, the ones that really look suspect. And, you know, you can kind of clear away most of this on an automated basis just with review. If you have the resources to build the taxonomy and to do the detection and to organize that. So again, a real opportunity there to help with technology. These can be very expensive. I mean, some of the largest settlements in the US have been through malware attacks that gained access to device networks. All right. And, you know, we saw this with Nuance, I mean, actually driving a change of ownership. Their breach costs were so high that they wound up being acquired by Microsoft. They couldn't stand on their own anymore. We just saw a recent $1 billion+ settlement with Zoll Medical for 10 million+ breached records. So, you know, the cost can be staggering. Now, on an individual basis, hard to quantify the human cost, right? So what really happens here is a cancer patient has their identity stolen. All right. How horrible is that, honestly, when you think about the human cost? I mean, these are kind of personal tragedies we should all feel compelled to kind of fix and address.
Definitely. No, that makes a lot of sense. And yeah, from my experience, we know a lot of practices that do have to go through that whole process of having to rebuild their structure, just so that they are up to standard with regards to industries or groups like the RSAGP here in Australia. So, you know, there's definitely value and significance to make sure that they are taking those steps to mitigate or do that prevention piece, so that it is going to reduce that damage and prevent similar incidences occur in the future.
I'll also put in, sorry, I was just going to say, I'll also throw in the patient's perspective on that as well. I mean, like Scott just mentioned, you know, if you've got a patient who has potentially found out that their general practice has had a data breach or a data leak, you know, it's not just affecting that one patient, it's affecting the thousands of patients that are within that patient's, that general practice's medical files that are held within there. So it's a real reputation issue as well for the practice, and how that's going to be something that they have to repair and build upon to come back from is going to be very, very significant, especially if you're talking about a practice that's in a remote community where they're the only health service provider. Well, what's the patient going to do? Do they have a choice to go to another general practice? No. So in those realities, we have to be so careful. And I think that, you know, general practice has a real responsibility in this space to be able to show itself to its community of patients that they are servicing, that we are taking certain measures in our practice to ensure data security for you. This looks like X, Y, Z, and even having that as a notification that goes out to the patients to give that sense of reassurance, or whether it's a poster that they put up in their practice so that when patients are sitting in the waiting room can read that and inquire of the administration staff or the practice manager what processes are being put in place. It just gives that sense of security for a patient, and that's really, really important, because it's not just the practice, but it's also the hundreds of, or if not thousands of patients that are on their file, that are active within their patient database, that need to be protected. So
yeah, definitely. That's great. Sorry, I'll let you jump in, Scott.
No, I just wanted to say, I mean, thematically, it really is important, right? I mean, we're trying to reach this empathetic state with our patients. You know, empathy is kind of this combination of trust and intelligence, right? We know them and they trust that we know them. And it's hard to get to any sense of empathy if there are trust issues. You know, that really has to be addressed with, you know, pretty substantively right off the bat.
Yeah, agreed, definitely. All right, so we've got a little bit of time left. I just wanted to open it up to see if Mario, you had some questions about that you'd want to ask Scott about the cybersecurity space, and likewise, Scott, if you have questions about what's going on in the general practice, especially regional where there is, that one practice that is covering, 100-kilometer or, 60-mile radius. Yeah, so you had questions there.
Yeah, I think one of the questions that we've been grappling with is the need for cultural change that happens in that digital health space because of learned behaviors. And we've got medical practitioners who have recorded, we know them every single day, that they're not just logging into one software. They're not just, they're not just logging into a patient management system, their emails, their computer, but there's actually potentially 16, 17 different programs and softwares, because you've got pathology providers, you've got radiology providers, you've got, different residential aged care facilities that they might be servicing, and they get an emergency phone call from there, and they've got to quickly check the patient's file. And all of these things take up what we classify as vital time for the GP, because, we heard this at the Digital Health Festival last year, where one of the doctors got up and shared about his experience of working in residential aged care facilities. And on average, it takes him 8 minutes to log into 16 different softwares.
Right.
Now, those 16 different softwares, he's got to be learned in the sense that he actually needs to know how to operate them efficiently so that he can actually get some of that time back. But he doesn't necessarily know where the potential leaks or hazards lie within those softwares. Why? Because he's trained enough to be able to get the piece of information that he's after and then log out of there so that he can log back into the next program and fill in the data, for example. And so putting that context to this space, and I know that it's not a magic wand that we can then all of a sudden wave, and the hospitals are talking to the general practices and residential aged care facilities, but there is that lack of interoperability, which causes significant lack in cultural change. But one of the things that I've been advocating for from Larter Consulting's perspective and talking to general practices is that the cultural change happens by the health professional first, in order for the patient to then make that change within their own behaviors and expectations.
Right.
But it's that space where you've got the GP potentially, or the specialist or the allied health professional, who is reluctant to do that. What do we do in those space to be able to, I guess, encourage and motivate change that happens organically, instead of it being a forced upon approach, which is what it sometimes feels like. It's just been forced upon you, so you've got to make the change.
Sure. Oh my goodness, Mario, like 5 questions in there.
Sorry.
No, it is fascinating, right? Because, in healthcare, so much of it is about, to your point, the behavioral change, the systemic change, the technical change. And you're absolutely right. Expecting patients to drive a behavioral change after we've spent a whole lifetime training them to behave a certain way is probably unrealistic.
Yeah.
So I think I look at 2 areas, right? The behavioral change. And increasingly, I think as an industry, healthcare is coming to the conclusion that value-based care makes a lot of sense. And really delivering value-based care requires that we share data. And I think we're at the cusp of the next level of that says, boy, if we have to share data, that means we need standards and integration. All right. Once we honestly have a set of standards and a rational, finite set of integrations, you'll see the vendors come in force. All right. Yeah. And the big cloud providers are already all over this market, right?
Yeah.
Look at the big hyperscalers, look at OT, which operates a pretty substantial cloud for its own customers. That's really happening. Mm-hmm. All right. And that changes a lot of things, right? So now I make a phone call and I get access to a high-end identity and access management system. All right, now I make a phone call and I get access to another set of standards or another set of data architectures, or I can implement something performant like Snowflake or like Vertica. and I can really begin to apply AI and ML to some of these problems. So, you know, I think technically we're on the cusp of a set of changes. You know, from a regulatory perspective, we're there. From a thinking perspective, you know, what's missing in a lot of systems now is the regulatory and the money. And, you know, I think the third vector here is resources, right? Value-based care might be the only care model we can afford in the long term. So hopefully that drives that discussion of value and standards and interoperability to the next step. But that's, I mean, that's kind of how I look at it, kind of big picture right now.
That's great. Thanks, Scott. I think just to give you all one little piece that will be of value, especially when we talk about that funding side of things. Yet I'm happy to share some further information here, but we believe that the Department of Health and Aged Care through Primary Health Networks is actually putting out $50,000 grants for general practices at this present moment. They're starting to come through very slowly. Each PHN will do it at a different time frame based on their own needs assessments, but general practices will very soon be able to apply for a $50,000 grant, and that grant is going to help them to be able to come to that place of digital health literacy and interoperability capabilities. Not saying that they will become interoperable, but they will have capabilities to do so in a much safer way. And the Department of Health and Aged Care Services have actually just put out a grant that will be published through and funneled through the PHNs. It's for general practices to be enabled to apply for a grant up to $50,000 that allows them to become more digitally enabled within their practices over a 3-year period. So it allows them to stage their approach when it comes to that. And even though they might receive the funding in one pool at the start, they'll be able to actually work with their IT providers or even look at outsourcing their IT infrastructure to an IT provider who can actually provide much more support than just one individual person within the practice. And that digital enablement is around everything from becoming more, having more tools and repertoires under their belt to be able to do things like secure messaging, to be able to have digitally enabled conversations with their patients, like remote patient monitoring or hospital in the home, for example. They'll be able to do more telehealth. But I think the greatest point of interest for a general practice is going to be around that cybersecurity space and making sure that they've got the right softwares in place to be able to protect them, their staff, and their patients alike. So keep an eye out for it. Different PHNs will be releasing them at different times, but when it does come out, it is a grant that general practitioners should be putting time and effort towards in applying, and some real thought as to how they're going to implement that funding into their practices. So just leave that one with you.
Great. No, I definitely agree. I think what we're seeing is now that outsourcing of experience and knowledge from general practices away from having an internal IT manager or infrastructure manager, just so that they can get on with enabling, so that they can get on with patient care and the core of their business. And that's why Interfuse wants to be that point of contact, so that we can point those general practices to people like yourself, to people like Scott, that do have that experience around different areas that are a requirement, not just a requirement for the practice, but are going to mean that they can really improve their patient care and and ensure their business is up to standards and requirements. So I think it's a really fascinating space, or fascinating update. We've seen that happen, that funding or grant happen with small businesses. So it absolutely makes sense that it's happening in the healthcare space as well. So great.
There is the only other thing I'll say is that we believe that next year RACGP is also going to be putting out the 6th standard for accreditation. So it's not going to be the same that general practices have gotten used to over the last few years. And it wouldn't surprise me if in that 6th standard there would also be a core part of accreditation being digital health and digital health awareness and security, because that's just going to be the way our health care system is transforming itself, and so that would have to be embedded into general practice through an accreditation standard for sure.
Yep, definitely. Perfect. Great. No, I think we've got everything we need. So thank you so much again, Mario.
No worries at all.
As I said, we'll get all this sliced and diced and share with you guys before anything goes live. And if there's anything that we can help with from our end, or if you've just got anything that you want to have a chat about, more than happy to have a chat through that with you.
Sounds good. All right.
But thanks so much again. We'll speak soon.
Yep. Take care. Bye.
Bye.